The exercise stress test, also known as the treadmill test, is a way to see how your heart works during physical activity. It's connected to an electrocardiogram, which shows the activity of your heart. This test is advised by cardiologists for several reasons. It helps determine the capacity of your heart, especially during exercise. It's also used to understand the state of your heart if you have heart-related issues. It's crucial for planning a training program or future treatment, and it can detect underlying health problems. The test starts with a medical case history and a clinical examination. Then, you're connected to an ECG machine. An oximeter is clipped to your fingers to monitor oxygen levels, and your blood pressure is measured. You'll start running on a treadmill, with the speed and inclination increasing every 3 minutes. Your heart rate, oxygen levels, and blood pressure are monitored throughout. If you can't perform physical activities, a pharmacological exercise stress test can be done. Medications are injected to simulate the effects of exercise. There's also the nuclear stress test, which uses a tracer dye to show blood flow. Before the test, you're asked to stop consuming caffeine or any medicine that increases heart rate. Smokers should cease smoking at least 24 hours before the test. Diabetic patients should consult a professional about insulin intake. On the day of the test, avoid eating or drinking to prevent nausea. After the test, the treadmill speed is slowly decreased. You'll be observed for at least 6 minutes, and your blood pressure, oxygen level, and heart rate are noted. The test is scored based on metabolic equivalence achieved. A score of less than 5 is poor, 5 to 8 is fair, 9-11 is good, and 12 or more is excellent. The test is positive for myocardial infarction if the ECG report shows certain abnormalities. The stress test is not advised for those with uncontrolled angina pectoris, acute pericarditis, acute myocarditis, severe aortic stenosis, high blood pressure, or high-degree AV blockage. For women, it's essential to inquire about the menstrual period before the test. If a woman is pregnant, the test should not be performed due to potential risks. For an accurate exercise stress test, consider the best clinic in Waco, Texas. You'll be guided by expert technicians and well-educated doctors.